The biggest Medicare company in America just revealed which of their 8 million members are about to get screwed over, and I hate to say it, but you might be one of them. United Health announced that 1.8 million members in low-rated Medicare plans are about to lose benefits and cost more money. And they're even dropping 600,000 members completely by canceling their unprofitable plans. And when they announced this, their stock price jumped 3%. Investors cheered because cutting seniors out of plans, not just low-performing ones, but even some 4-star rated plans that members love, means billions more in bonus payments for shareholders. Think about that for a second. Even high-rated, popular plans with great coverage and real freedom of choice are on the chopping block if they don't fit the company's profit strategy. And it's not just United. Other major insurance companies are doing the exact same thing across the country. So let me break down what's really happening, because this news is affecting millions of people on Medicare. Medicare rates every plan from 1 to 5 stars, and it's based on more than 40 different things. How fast you can get an appointment, how well your prescriptions are covered, how they manage chronic conditions, and even how easy it is to reach a human when you call the customer service department. But in 2024 and 2025, Medicare changed the rules, and they made it way harder for insurance companies to keep their high ratings. And insurance companies were so upset that multiple actually sued the government over it because the changes tanked their scores. We're talking billions of dollars in lost payments, all because of new rating formulas. One big one was called the Tukey Outlier Rule. I know it sounds like we're in math class, but stick with me. Basically, Medicare started throwing out the best and worst scores when they calculated the benchmark. That made the bar jump higher overnight, so a plan that was a solid 4 stars last year could suddenly drop to 3.5, with no change in performance. Companies like Scan Group actually won their lawsuit over this, forcing Medicare to recalculate the ratings. And that recalculation meant $250 million in bonus payments having to be paid out. Then there was the call center fiasco. Medicare sent in secret shoppers to call insurance companies, and if even 1 or 2 calls didn't go perfectly, boom, your whole rating could drop. United Health went to court saying an 8-minute phone call cost them a star, and a judge agreed. Humana, Elevance, Centene, they've all taken CMS to court over this. Some have won, some have lost, and some are re-suing, but all of this shows just how much money is online here and why insurance carriers care so much. A 4 or 5 star plan gets a huge bonus from Medicare. We're talking billions across the industry, and that money lets them lower your copays. They add dental or vision coverage. They even put extra dollars into your Social Security by lowering that Part B premium. On the flip side, if a plan has 3 stars or less, it gets nothing. No bonuses, no extra cash to sweeten the deal. And those are the plans companies end up cutting or dropping entirely. So when you hear star ratings, don't just think it's a number. That rating decides whether your plan is affordable and full of benefits, or whether it gets gutted to keep shareholders happy. Right now, insurance companies are in full profit protection mode. Medical costs are skyrocketing, people are using more health care, and Medicare is paying out less. So companies are cutting their lowest performing plans and focusing all of their resources on their profitable 4 and 5 star plans. And this all ties into something even bigger. Insurance companies are now so focused on protecting their profits that some, like United Healthcare, are even cutting off commissions for independent brokers like me for certain areas and plans. Yeah, that's a whole separate issue, but it shows you exactly where their priorities are. I've got another video breaking that down and how it can affect you. You can check it out right over here, and I'll also link it in the description below. So here's what all of this means for real people like you. If your plan drops below 4 stars, your copays might go up. Extra perks like gym memberships, dental, over-the-counter allowances, those might go away. And if a company decides the plan isn't worth keeping, you could wake up to a letter saying that your plan's being discontinued entirely. That's why at least 1.8 million people are in trouble right now. The 2026 ratings officially come out in October, but companies already know their numbers. United Health bragged about theirs last week. The other big players, Humana, Centene, CVS, they're staying quiet. And in this industry, silence usually means numbers aren't so great. So when October rolls around, go to Medicare.gov and check to see what your plan's star rating is. Or honestly, just call me. I can look it up in 30 seconds. If you see 3 stars or lower, that's your red flag. You're in a plan that's more likely to raise costs and cut benefits. The good news, during Medicare annual enrollment, you can move into a 4 or 5 star rated plan if there's one in your area. And a lot of the time, it doesn't even cost you more. And in fact, sometimes people switch and actually pay less for their health care. Don't be a part of that 1.8 million people getting left behind while insurance companies protect their profits. I'm Callie, a licensed insurance broker and certified Medicare expert. If you want me to check your plan's rating or walk you through all your Medicare options, just call me or schedule an appointment. It doesn't cost you anything to work with me. And hey, if you've got questions about how those star ratings work, drop them in the comments. I read and respond to every single one, and I might even turn them into a future video. And as always, if you found this video helpful, please be sure to give it a like and subscribe to the channel. And after that, click right over here to check out my next video with more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.